those of you who have been following me, you know, just a few weeks ago, I was a guest on the Chamber Talk Show, and I wanted to bring back Dr. April Gibbons. So we're going to be speaking today about the three aspects of mental health and just kind of revisit that conversation about mental health issues, particularly as they apply to our teenage girls. So let's get Dr. April on board. Now, Dr. April, you are a psychotherapist and you see both adults and children. Is that right?
Yes.
All right. Well, tell everyone a little bit more about your practice, like how long you've been in practice, and then what's the breakdown in terms of your demographics, like how many adults and how many children?
I was saying that I'm Dr. April Gibbons. I'm a licensed psychotherapist, but I'm trained in so much other stuff. I'm also a psychobiologist, herbalist, certified hypnotherapist, certified trauma therapist, and I am an author now. I have my recent book journal, self-help journal called Strategies and Tips to Improve Your Overall Well-Being. And you know, my practice consists of, it's a 501c3 nonprofit called Urban Counseling Click. So that's the nonprofit side of the practice. But we also have Dr. April Gibbons, the private practice, the for-profit side. And what we do provide individual therapy for teens, couples, adults, and families.
Well, congratulations on being an author, and it sounds like you're a busy bee here. You've got the nonprofit running as well as your for-profit practice, correct?
Yes, correct.
So it sounds like you do some of the things that we do in primary care as well. So how do you team up with physicians in your area?
Well, what we usually do is, of course, primary care doctors, if the patient is exhibiting any, depressive symptoms or whatever, typically they'll give a referral, to a therapist or a referral to a psychiatrist. If the person is deemed to be severely depressed and they may need some medication management. So then, that branches out. So we all work together. We have this network of, who needs to be seen. And a lot of times, it may go to the therapist first, and then we determine if the patient needs medication, and then we'll refer to the psychiatrist.
Okay. Now, what about the holistic part? You mentioned that you were an herbalist as well earlier. So
Yeah.
How do you incorporate that into your practice?
So in my practice, we deal with the mind, body, and spirit. So everything is incorporated, the whole wellness component. So we try to find out what's going on, what's happening in your body, because your mind is powerful. But a lot of times your mind influences things that's going on in your body. And a lot of people don't know that supplements, vitamins, and minerals, if you are deficient in some of these things, it can contribute to your depression and your anxiety and different chemical imbalances. So a lot of times you may not need a prescription medication. You may just need to find out what you're deficient in. If it's vitamin D, if it's the B vitamins, to include B5, B6, B2, B12, all of that plays an important role. Iron also plays an important role. 68% of Americans are magnesium deficient. So magnesium plays an important role because it helps metabolize the vitamin D and all other processes in your body. So all of that's important to know.
So do you end up sending some of your patients to their primary care physician to get these labs drawn to
Yes.
determine if they have the vitamin and mineral deficiencies?
Yes, absolutely. So it's important to, and I tell my patients, hey, go to your primary care doctor and ask them specifically to do a micronutrient test. Micronutrient test is typically, I know me, you talked about that's not something that's generally ran in normal panels. So they need to ask for it specifically. And what they do is they check what your vitamin levels are and they let you know. So you can find out if you are vitamin D deficient or some of the other vitamins. And then you can start on a supplement that's appropriate for you to help with that deficiency.
Now, have you noticed a lot of success, particularly with your young patients, once you discover perhaps they have a vitamin deficiency and they begin taking the supplement, and that actually helps such that they don't have to necessarily go on prescription medication?
Yes, absolutely. I have a number of cases, a number of patients that can testify to coming to me, and we've talked about, what it is that, like, for instance, I had a kid that came and was experiencing kind of, the ADHD typical symptoms, and noted everybody doesn't have ADHD. I think that diagnosis is, overdiagnosed. Sometimes, kids are just kids, or they're not getting the correct balanced meal that they need. What kid do you know that's eating like they supposed to? Like, just be honest. And so parents need to have your kid on a multivitamin. When I was a kid, we took Flintstones, so now they have little more advanced things that you can take, gummies, DHA vitamins. All of these things are important for your child. So what we do, we go over what's the diet like for your kid, especially if you have a 5 or 6 year old. Like, what's happening there. So you have this kid that's running around, not staying still, and just active. And you're like, okay, what's going on, with him? I told one family, I was like, okay, I need you to get a magnesium zinc combo. And so I told them exactly the milligrams and everything to get. They started the child on that, and it was just amazing. They were like, he doesn't do this anymore. My pediatrician even noticed when I took him there that he wasn't running around the room, running around the office like he usually do at every visit. He was just calm and still. So we like, hey, and I was like, yes, continue to do that, because a lot of time kids are imbalanced. My kids take vitamins. I give them to them daily, and they take them. They love them. If I forget, they ask me for them, because it makes a difference. It helps them focus. It helps them break down and metabolize some things in their body as well.
Well, I bet those parents appreciate being able to take something more natural, and it saves them the co-pays for prescription medication that
Right.
they may get from me, for example. So it's good for people to know that there are some alternatives. And I happen to be a big proponent of natural things as much as possible. In particular, when it comes to the pediatric population, medication is my last step. I do refer to therapy, particularly when we have young people who I feel are struggling with mental health issues. Because with prescription medications, I do have to take into consideration possible side effects
Right.
for our young people. Now let's move into talking about those 3 pillars of cognitive behavioral therapy: the mental, the emotional, and the behavioral. I brought that up on your show when we talked on the Chamber Talk show a few weeks ago, and I wanted to explore that a bit further.
Okay.
Personally, I feel that the mind is the most important part of our bodies. But unfortunately, sometimes it seems as though in our culture, that's the part of the body that we protect and develop the least.
Right.
Whatever's going on with our minds, it certainly will affect our emotions,
Mm-hmm.
how we feel, and then that will also manifest in how we behave.
Absolutely.
So let's talk a little bit more about that from your perspective as a psychotherapist.
So what we usually do, and that's exactly correct, that's what we deal with. So that's the premise of CBT, cognitive behavioral therapy. So we deal with the thoughts, and the thoughts influences your emotions, and the emotions go into action. So thoughts, emotions, actions. We use the cognitive triangle to try to explain to people this is what's happening. So generally I provide like a journaling exercise that I have my patients do. So we'll talk about, what's going on, what's the situation. So they'll tell me, okay, the situation could be me and my, husband are not getting along in our relationship. So what are your thoughts about that situation? Just tell me thoughts. What's happening? I'm thinking, is it a possibility that we're going to separate? Is it a possibility that we're going to divorce? How long am I going to continue to do this? What am I missing in our relationship? So now tell me your emotions. What are your feelings? Just your emotions: happy, sad, angry, upset. So we list out all of that, and they'll say, well, I'm feeling a little overwhelmed, or I'm feeling anxious. So we list that. Now, what's your plan of action based off of your emotions and your thoughts about this particular situation? List 2 steps of what do you plan to do to help you move forward. So we develop this plan using all of that. And generally by the time you go through the steps, you have a level of clarity that you can see, okay, this is what's going on in my life. And maybe these are some steps that I need to take. If it's having an effective conversation with this person to talk about, this is how I feel. This is how this situation is making me feel. Now, what can we do to move past it? What are you willing to do? How can we reach a level of compromise?
Now, take that same situation and let's apply it to the daughter of this couple, right?
Okay.
The teenage daughter. So, have you experienced that where one of your clients says, my parents are arguing a lot. This is affecting me, how it makes them feel. How do you guide a young lady through that when she's got concerns about perhaps her parents getting a divorce and how that will affect her?
Right. So we talk about what that means for her. And to be honest with you, it's surprising that most kids prefer their parents to be divorced. The parents are worried about the fact that, we have these kids, we need to stay together for the kids, and all the hundred reasons that people come up with as to why they need to stay in a relationship that's unhealthy. So, and when you talk to the kids, they'll tell you, like, I just really wish they would just break up. It wouldn't be so bad if I, visit whoever on the weekends and we just kind of they separate. It would be more peaceful. So finding out their perspective. Now they dare tell their parents this. They won't say that to them, but they'll say this, in therapy. And so sometimes, we work out a plan to how can you communicate this to your mom, or you communicate this to your dad, whatever parent you feel most comfortable with talking about this situation with, because that could make or break away the whole situation, because you're thinking that the kids are going to be affected and the kids really want you to break apart. So I think really using that same model, thinking about that situation, okay, my parents are not getting along, either I care or I don't care, or how is it affecting me? So then, what are your thoughts? All the thoughts that they're saying, like I just stated, I wish they break up. If they separate, it'll be better for all of us. Maybe I can have some peace, or whatever the case may be. And then you have the emotional aspect. I'm frustrated. I'm angry. I'm anxious. All these different things that go along with it because of so much toxicity that's happening in the environment. And so now what's the plan of action? The plan of action can be have a conversation with your parent. Or, some people are not comfortable with having that conversation. So writing a detailed letter, being very specific, and giving it to your parent, mom, dad, or both, to where they both can read it together, process it, and you're asking them, hey, once they read it and process it, and then you come back together at a time and you can discuss what was in the letter.
I was a bit surprised when you said a number of your clients say they would rather their parents, pardon me, get a divorce. Now, interestingly enough, I addressed this a little bit in my book, Nia and the Numbers Game. And there's one point in the book where the main character talks about feeling somewhat relieved because her parents weren't arguing anymore. It's not so much that she wanted them to get the divorce, but after it happened, there was some relief
Right.
simply because things were more peaceful. Let me ask you this. We've talked a bit about the first two, the mental and the emotional part. What are you seeing in terms of behaviors in some of your clients that, of course, you help them to work through when they first come to you?
So some of the behaviors in the teens specifically could be social anxiety or anger. A lot of times it's anger, and it's displaced anger. It's anger because maybe somebody's not there. Maybe there's a single parent, and then you're wishing that you knew or had the other parent around, because you go to school and you have your friends who may have both parents in the household. And so that's affecting you because you're not able to do some of the things that they may be able to do in the two parent, households, especially school activities. Sometimes they have the moms with muffins and dads with donuts. And so if you don't have a parent to bring to those things, sometimes the kids, they internalize that, and that in turns come into the self-worth issue. Am I worthy? Did this person not want to be in my life? Like all these questions the kids start to have about themselves. And so just really being positive and motivating them to know that this is a situation that has nothing to do with them, not for them to internalize what has happened, and being able to move past that and start to kind of revamp and refocus on what's happening right now in your life and point out some of the positive things that's going on, and continue to build off of that.
In terms of certain specific behaviors, do you see changes, for example, with their grades, changes with their social groups,
Right.
perhaps either withdrawing from their social group and spending more time, let's say, on social media? Or are there any other behaviors that you're seeing specifically in these clients that you say are suffering with a lot of anger?
Yeah, more of withdrawing, isolating, withdrawing from their social group, isolating and staying in their room, trying to stay away from everyone, including family, not eating with family, maybe eating in their room, and just kind of texting their friends, the friend group, not wanting to hang out or go anywhere, but they will still have the communication of texting, and being on social media. So I think a lot of those things influence their behavior and how they feel about themselves too. And then body image, issues. That's one thing as well, because you see the different things on social media and you want to look like it, or perception is reality. So it's like, some of those things are going on as well, and they want to know, why do I feel this way? Is something wrong with me? And so the first step is understanding that, nothing's wrong with you. How you feel is completely normal. But okay, let's turn that around. Let's focus on self-love and self-care. What does that look like? Building up, self-confidence and self-motivation and self-discipline. So creating a plan around that and designing a level of structure to where they can implement this plan. And I love dealing with teens because they will actually put in the work and develop the plan and implement the plan. They do it a whole lot faster than adults do it. So it's good to be able to see them do that and see the change as it's happening.
That's really cool. I did not necessarily expect that. But then again, that makes sense, right? Young people are very quick to adapt. I think as we get older, we get a little more set in our ways.
Right.
So that's interesting that when you come up with a plan for your younger clients, they're working on it.
Yeah.
So are there some apps, for example, that young people can use, or really even us older people can use? I know you mentioned the journaling, but are there any apps that people can use for their mental health, since people are engaging with their devices so much these days?
Right. And I tell people that all the time, hey, you have these smartphones, utilize them. It is tons of information, there's tons of apps out there. One app that I really like to recommend is called Sanvello, Sanvello. And it's an app for anxiety, stress, and depression. It's an amazing app. It's a free app, so you can download it free. They do have some premium features that you can pay for, but it bothers you. That's what I like about it. It provides a check-in for you all throughout the day. Probably 3 or 4 times it'll ask you, how are you feeling? How are you doing? So you go into the app and you complete the check-in. I'm feeling sad, or I'm feeling overwhelmed, or I'm feeling angry. And then it designs a 5-minute meditation, a guided meditation based on what your check-in is, and it walks you through that. So you can kind of unwind for a minute, do the 5-minute meditation. After that, you're calm, you have released all of that, and then they have a journaling prompt. You can journal your thoughts and your feelings and your emotions and your actions all within the app. So it's amazing.
So I like that idea, and I put it in the chat. Sandilo,
And Velo.
S-A-N.
It's Sanv as in Victor, Ello. Sanvilo.
Uh-oh, I misspelled it. So let me put that in the chat again. I thought you said D. Sorry about that. Sanvello, right?
Sanvilo.
Okay. Well, thanks for that information. That is a great tip. All right. Well, Dr. April, let's start wrapping things up here. Are there any specific messages you want to give to our young people?
Well, I want to give, I guess, an important message to the young people. I want them to know that, they are worthy, and continue to practice affirmations. That's important. speaking positivity into yourself. Sometimes we don't know what children are experiencing. We don't know what they're going through in their immediate environment, that they're victims of, domestic violence that they're witnessing in their home. And kids can't leave. If your parent is going through these things, you're just stuck there and you have to deal with it. So I think it's important for those kids out there that are experiencing some things to be able to, just motivate themselves. Get in the mirror, pick 5 affirmations, positive things that you can say to yourself, like, I am worthy, I am loved, I am going to be okay, everything is going to work out for me. Even if it appears like it doesn't at this point in time, but continue to say those things, speak positivity into yourself, and everything will work out and you'll be okay.
Well, thank you, Dr. April. I appreciate this. And I really think this Sanvilo app is quite interesting. I'm going to look into that and maybe recommending it to my patients as well.
Yes, it is. It's amazing. You are welcome. Thank you for having me.
Now, before we leave, I wanted to give everyone out there an update and let them know about something that's brewing in the Dr. Kela world. Let's Talk Teens. I have a new website, and what we're looking to do is start a show and make this even bigger with Let's Talk Teens. So I'm putting the new website in the chat. It's Let's Talk Teens with Dr. Kela. So everyone go over and check that out. So it's Let's Talk Teens with drkela.com.
Okay, congratulations.
So just launched that new website today. So you guys can go over there and check out what's going on, like I said, in Dr. Kela world. Dr. April, thank you so much for joining us.
You are welcome.
I really appreciate it. Our young people need to know that they have us in their corner. And I like what you said about the affirmations, right? I am worthy. I am loved. I think this is huge for our young people who are dealing with mental illness, because those negative thought patterns can get them into this spiral. So to reverse that is to say the positive things to themselves.
Right.
And once it starts here, it flows, right?
Absolutely.
We think positive things, we then begin to feel positive things, and then it manifests as better and more positive behavior.
Absolutely.
Well, Dr. April, thank you again for joining us. And
Bye.
everyone, this concludes this week's edition of Let's Talk Teens with Dr. Kela. Check out the new website, and I will see you next week.